Welcome to Live with Hillsdale Hospital. Today is Wednesday, July 17th, and we're here to keep all of you, our patients, families, neighbors, and friends in the know and up to date on the latest health news in our community. I'm Rachel Lott, Chief Communications Officer, and I am joined as always by
JJ Hodshire, President and Chief Executive Officer. And today I am so excited. We have American models, as you can see, with us today. And outside of that, we do have two amazing people and a provider who has been fantastic for our community here at Hillsdale. We have built a strong friendship professionally and personally. And it is my pleasure to introduce for the very first time to our Facebook. Now it's not Facebook, it's live.
Our live stream.
All the platforms
on
live.
platforms,
Yes. Dr. Loganathan and his practice manager, who also goes by the last name of Loganathan, his wife, Nikki. It is so great to have you both here today.
We're so excited.
It's going to be great
Thank you.
because
thank
you are doing some tremendous work in Hillsdale. And I'm going to give you a little hint. I just got some data reporting back.
Okay.
And you're leading the market for neurosurgery in Hillsdale and Branch County for our catchment of patients. We're going to talk more about that.
Oh,
So this is
wow.
exciting.
That's awesome.
Good.
It's amazing.
Short trip here, obviously, and now you're doing remarkably well. Our patients are telling me all the time. I get comment cards, you're hearing it, emails. They love you, and they love your office practice, the work that you're doing to get patients through. So I'm excited. That's just the introduction, folks. We haven't got into the program yet, but we are excited to have you in the studio today to talk a little bit about what does this practice look like, what types of procedures are you doing, how does someone get on your schedule, how do we pay for it, those type of things.
Yep.
All important questions for our community, but it's incredible to think, Rachel, Hillsdale Hospital has neurosurgery. And, you know, it had been told to me 5 years ago when I took over, you know, we would never have this type of service line here. And we have an incredible service line.
I think there were times that we even maybe said that.
I think so.
Off the cuff of like, well, we'll never be able to do things like
Right.
neurosurgery. And they were like, wait, why?
Yeah, but
why
we
not?
can, absolutely.
Yep, and we can.
And so we're excited that you're here. We'll talk a little bit today about how the community can get engaged in your practice. So, Rachel, why don't you go ahead?
Yeah, well, let's
take it
start because for patients who have never needed neurosurgery, they may not have a great understanding of what is involved in neurosurgery. And also sometimes certain things people think, oh, I need to go to orthopedics, but it's actually neurosurgery. So tell us a little bit about neurosurgery and the kind of care you provide.
Sure. So I'm a general community neurosurgeon, and what that means is that when people and providers have need for someone that's a neurosurgeon, they come to see me, you know, with their general problems. What that usually entails, especially in our community, are things like spine problems. That's the majority of what we treat. A lot of it's operative spine problems, things that need an operation, but some of it's non-operative as well. And a lot of the time, a primary care provider is able to identify, hey, you have some kind of a issue with your neck or your back, and you need someone to kind of help sort that out and decide, well, do you need something surgical done, or do you need something that's not surgical? And so that's the kind of patient that we see quite often.
Yeah. So spine, you know, you talk about that, but I mean, what does that involve in terms of operative? When you think, when someone's coming in for a procedure, what types of things are you doing?
Sure, that's a good question. So low back pain is the number one reason people go see their doctor and have disability in the whole world.
Yeah.
You know, and so when they come to me, usually they have severe back pain, neck pain, pain in their arms, or pain in their legs. And usually the types of things that they end up needing are things like a discectomy, taking out a little piece of a disc that's pinching a nerve in the back or the neck. Sometimes they need something called a laminectomy, where we have to remove a little bit of bone and ligament. Sometimes they need something called a fusion, where there's a part of their back or their neck that is unstable, or unpinching the nerves that are pinched are going to end up causing some instability, and that's a service that we provide as well. There are a few other things that we do commonly. People have heard of artificial discs. You know, when they have a bad disc in their neck, we do a lot of those. People also ask about artificial discs in the low back, but that's something that's really rarely done in this country, and so so that's something we don't do.
Yeah. So what type of material are you working with when you put a disc in?
Sure. The material is made out of different types of metals, such as titanium and sometimes cobalt chrome, and then usually the artificial discs have a special type of plastic there too.
Okay. Okay.
So I guess let's talk a little bit about, if the general community is listening to this, they're having some pain. What happens next? Do I talk to my primary care? Do I go see a general surgeon first? Or how should that look?
Yeah, usually the best thing is to see your primary care provider. And the reason for this is most people that have back or neck problems don't need a neurosurgeon, whether that's for surgery or some kind of non-surgical intervention. And usually it's normal for your primary care provider to say, hey, let's try some physical therapy or some anti-inflammatory medications. Not only is that the right thing to do, but that's usually what needs to be done before you can see us. Some people need a referral to come see us, and that depends on their insurance. Nikki can talk more about that.
We're going to talk about that because that's important.
But we're happy to see anybody.
Yeah.
But the chances are most people will probably get better without having to see us.
And is there a particular type of service you see more of in Hillsdale with your practice than maybe is the norm, or maybe not?
Maybe not. I think like, kind of how I referenced before, you know, some neurosurgeons specialize in surgeries involving the brain.
Yeah.
And, that's something that here in the Hillsdale community, we find that we have a lot more spine issues to take care of. And so that's kind of what we focus on.
Okay. So let's talk a little bit about payment structure. Okay.
Sure.
So I am, a Medicaid patient, or I am a Blue Cross Blue Shield patient. Do you take all payers?
We do. We take the majority, and the only one that I think really requires a referral is Blue Care Network.
Okay.
And so, we get a lot of patients that call and say, "Do I need a referral?" No, you don't. You know.
So what happens if you determine they do? So if the BCN?
Yeah, if it's BCN, I say, hey, just call your primary care provider. Let them know that you're interested in seeing our physician, and they shouldn't have an issue of sending a referral over to us.
Okay.
And it's usually pretty painless for the patient. It's a very easy process.
Right.
So if I do not have a primary care provider, or I just don't want to do that, I can still call your office and say, I need to see the doc.
Absolutely.
I'm not feeling well.
And I tell the patient, because generally right now we're at a 6 to 8 week wait list. And so I tell the patient in the meantime, if you want to reach out and try to contact your primary and get some x-rays or MRIs or any kind of imaging done, that's only going to help your consult. When you come in for the consult, it's only going to be more beneficial to you.
Right. Because then you have more information to work from.
Yeah.
And it could speed up the process.
Exactly.
If
And
you
that
do
way-
end up needing surgery, it probably gets you there faster if you come in with some initial testing already done.
Exactly. Because then I feel like it's not just time wasted.
Yeah.
You
Right.
know?
Yeah.
And they'll get the most out of their consult if he has some images he can look at.
So really urgent stuff, like I can't move. My family is majorly worried about me. I'm worried about me. I have to wait that 6 weeks.
No.
Okay.
So, and this is where he, this is where I think I drive him a little crazy.
Right.
I have a sweet spot, and I can't. And we're at 3 Meadows sometimes till 7, 8 o'clock at night.
I know you are.
I will get those people in.
Yeah.
I won't make them wait. They call me crying. I know they're calling me at their most vulnerable state, and I can't.
So a friend of mine who I referred to you will go nameless right now, but I had followed back up with his wife and said, "Did we get you in?"
Yeah.
Oh yeah, we got you in 3 days later, and I'm like, "Okay, I'll meet you over there. What time are you going to be there?" And he said 7:20. I'm like, "No, 7:20 and 7:20 tonight."
Yes.
And he goes, "Yeah, 7:20." I'm like,
Yeah.
7:20 tonight.
Yeah.
Okay, well maybe I won't meet you there, but
Yes.
let me know how that goes.
Right.
And it speaks volumes to the fact that you're willing to be here late
Yeah.
and to serve our community and our patients. That's really unprecedented.
Yeah.
And that's what's really exciting to see. So let's talk a little bit about the structure of the practice hours.
Sure.
So can you tell our listeners, where are you? How do we get in? What numbers are there? Those type of things. Is there a website?
Yes, all the things. So we are in Hillsdale now, Tuesdays and Thursdays. Phone hours are 9 to 5, but my patients know they can always get a hold of me. They call me after hours. They text me. I am very responsive. They know that they're always going to hear back from me same day. So, I guess 9 to 5 is just a loose time of hours. We're generally there anywhere from 8 till 7 p.m. Office-wise, just seeing patients. We're averaging probably about 60 patients a week now, and so in clinic.
That's
and
incredible.
so, but the referrals, I mean, the community has been outstanding with just sending us patients. The providers in the community, it's just been we've had such a huge support system since coming on board here.
Yeah.
And but our biggest referral source still remains word of mouth. You know,
Right.
you don't know how many times a day patients run into their family members in our waiting room.
Right.
It's just
Yeah.
very common
Right.
practice.
Right.
You know, my dad said I had to come to you, or
Yeah.
you know, you did surgery on my grandfather. He's doing
Yeah.
great. You know, and so Hillsdale is 9 to 5 Tuesday, Thursday. Jackson is every other Wednesday now.
Okay.
So because we've just increased our operating time here. And so now that he's operating more here, it's kind of reducing our clinic time.
So clinic
okay.
in Jackson, and
Every
the
other
location of
Wednesday.
Jackson.
Jackson is 1400 East Michigan Ave.
Okay.
We're right there next to Loomis Park, and we are there. That's loosely 9 to 5,
Yeah,
but
yeah.
we're there till 7, 8 o'clock at night.
All right, so I
So-
make my appointment with Nikki, and I'm like, dang it, I live in Hillsdale. I'm probably gonna have the surgery done in Jackson, right? Where do you do your surgeries?
Since December, I've done every single one of my surgeries here in Hillsdale.
Oh wow!
Wow.
And it's a
I think I set that up for a
Yeah, I
response.
think you did.
Wow!
Teed that up
Every
nicely.
surgery here at Hillsdale.
And
That's
I-
incredible.
I think we're at about 175 surgeries
Yeah,
Wow.
in
it's
that
amazing.
time since
It's amazing.
December.
It's incredible.
That's
Yeah,
excellent.
it is
It's
really
incredible.
cool.
And the beauty is, and the reason I queued that question up is because patients who lack transportation, challenged by public transportation, can't drive 40 minutes.
Yeah.
30 minutes. Driving to Hillsdale in their backyard is so critically important for access to our patients. They're right down the road.
And why should
It's
they drive
amazing.
anywhere else,
And
right?
why should they
Right.
drive
Yeah.
somewhere else
Yeah.
when the
Right.
services can be done here?
Right.
So the type of services that you've described before, neck to toe, right? That's pretty much what your specialty is.
Exactly.
If something is beyond your scope, which there may be one or two cases that are, you have a referral relationship with a partner or someone, right?
Yeah.
That you will say, you know what, I'm not comfortable with that. And you'll make sure they get somewhere on the journey.
Yeah, I have some other colleagues that are neurosurgeons and some that we have a partner relationship with, and we will send them out to the person that's appropriate to
Yeah.
send them to.
Yeah, absolutely.
Yeah, because that's important, obviously.
Oh yeah.
Then the other aspect is ancillary services, or you send them for x-rays and those type of things. We do that right here at Hillsdale Hospital. And that's the beauty. We can, and hopefully you found getting into those services has been convenient for
It's
your
been so
practice.
convenient. I mean, I'll even tell you that our patients in Jackson have been
Yeah.
coming out to Hillsdale
That's
to get their
it.
imaging and things like
Wow.
that because it's just so quick.
Yeah.
You know,
Be still my heart. Be
the
still my heart.
turnaround time has just been,
Yeah.
you know, patients
Yeah.
are like, we
Can-
don't want to wait 3 to 4 weeks.
Right.
Can I ask you
you
a
know?
question
Yeah.
about the quality of the images that you're getting from our radiology team? How do those compare to anywhere else you've practiced or anywhere else patients' images are coming from?
They're just as good or better, and I'm not just saying that because JJ's next to me.
But thank you.
Because we hear
but
a
they-
myth, we often hear the myth
but
that
not
like,
just
oh,
that.
Hillsdale's images aren't good enough.
No.
But you're
The
telling
big
us that's not even
conglomerate
close to
systems
true.
would often say, oh, you can't go there because their images are bad.
Or
So-
they want to charge you to do another X-ray.
Not only that, and not only can Hillsdale often get them in quicker for, say, an MRI, which is often the thing that we need in spine surgery, an MRI
Yeah.
of the neck or back.
Yeah.
But the image acquisition times are much quicker too. And my understanding in talking to the folks in radiology is this is due to a software update that happened in 2022.
it did.
But the lumbar spine MRIs and the cervical spine MRIs are around 20 minutes or less.
Yeah.
And so for someone that's suffering and
Yeah.
their back is hurting, their neck's hurting,
They
don't
can't
wanna
lay down
lie
for a
the
long
thing.
period of time.
Man,
Yeah.
that is
Yeah.
a huge thing. So not only are we often able to get people in quicker to get their scan done, but we're often able to get that scan done in a quicker amount of time.
Yeah.
So
Yeah.
people
So
come from all around.
More comfortable for the patient that's in pain.
Yes.
So the longer they have to lay there for an image, that's a problem.
Mm-hmm.
Just as good, if not better quality, and also a faster turnaround time to get in and get out.
Absolutely.
Yeah, and to be fair, I didn't know all of this until I started coming here, but
Yeah.
now I do, and so
Yeah.
I think
Right.
it's our, it's upon us to make sure our patients
Right,
know this.
right.
Yeah.
Absolutely.
Can we talk a little bit about the OR? Because something I always like to talk to even my own providers about is what is their experience practicing in a particular hospital or a particular OR, sometimes comparatively to another hospital, but sometimes just in general. For you as a physician and as a surgeon, what's really important to you in the OR that has made you want to do all your surgeries here since December?
So there are kind of three things to think about. Number one is, and this is something that patients can relate to, do we have the stuff that we need to do surgeries well? And the answer is yes. Some of the things that I care about as a neurosurgeon are a microscope. you know, something that'll let us magnify things like nerves and look at them closely. The right OR table, because different surgeons and different surgeries need different types of positioning. Yes, we have the table we need. And some of the other equipment, yeah, we've got all of that. So number one, equipment is here. Moreover, there's some other equipment that I think we'll be getting soon that kind of lets us expand some of our ability to do that. More on that later.
Yeah.
So equipment, one. Two is, do we have the people we need to provide the help to the surgeon? The answer to that is yes. Hillsdale is a hospital with that serves its community, and there's certainly hospitals that are bigger, but you know, I can only do one surgery at a time, and so we have the people that know how to help me with my cases, and things have gone very well. The last thing is, how quickly do things move? And this is something surgeons care about that maybe patients don't realize as much as, well, can we get a surgery done, and then can we get to the next one in an efficient process? Because the operating room is not just about, the most important thing obviously is a surgery, but you know, you have to take time to get things ready for the next patient. And that time can vary quite a bit from hospital to another hospital. I can honestly say that this is the fastest turnaround time from one case to the next that I've seen at any of the,
That's awesome.
I'd say 5 hospitals or so that I've been
that's
at.
awesome.
So that's pretty cool.
Yeah, I mean, he'll call me at 5 o'clock and say, we did 5 cases today. I'm on my way home.
Isn't that
And
amazing?
I'm like, oh my gosh, you
That's
know,
awesome.
this
That's
is
awesome.
great.
That is
you
awesome.
know?
And
That's great.
ultimately, that means more patients are able to get the surgery they need sooner if you're able to be more efficient
Right,
in the
right.
OR, right?
Yeah.
Absolutely.
Throughput.
And by getting things done in a reasonable amount of time, then we're not putting the fatigue, not just on the surgeon, but the rest of the staff too, and keeping them here late. And that's an important thing as we do this over and
Right.
over and over again.
Right. Let's talk post-surgical. So I have my surgery, and what happens next? Are you ordering therapies? Is it home care? Is it PTOT services? What types of things are you ordering? And then when do they come back to schedule that appointment to see Nikki if they need to? Can you talk about that?
Yeah. First things first. Most of my surgeries that I do are outpatient.
Okay.
The vast majority of people go home the same day.
All right.
Now, in order to do that, we have to have a good system. Now, there are things that we do in surgery to allow us that to happen, but also after surgery. For example, if somebody needs to get a hold of us after hours, especially on the day of surgery, they can text or call us. And I have our phone, which is a mobile phone, by my nightstand any night that we operate. Second thing is, I call every single one of my patients the day after surgery. I talk to them. Third thing is, we have already made an appointment to see that patient back in the office, usually within 2 to 3 weeks, sometimes sooner, sometimes later. And each time they come to the office, they are seeing me as the provider.
Yeah.
So the person that did the surgery, who knows every
actually there.
detail, is actually there. That's something that I want to emphasize. Now, in terms of other services such as PT and OT, sometimes people need physical therapy and occupational therapy, things like that, after a spine surgery. Usually, we like to wait on that probably around 4 weeks or so, and then make a decision. When they do that, when they do need something else, we set that up. The exception, and that's contrasted to what people are used to with, say, a joint replacement surgery,
Right.
where every single person does
Yeah,
physical therapy.
absolutely.
It's a
I
little
was just
bit
going to
different.
ask you that about, does that just the nature of the healing process in the spine as opposed to other parts of the body where people might be expecting to have PT within a week from having surgery?
We really like to
Correct.
assess people too on a case-to-case basis.
Yeah.
You know, if a patient comes in and, you know, they don't have a lot of help at home and they're having a big surgery, then we know this person's going to need home care after
Yeah.
surgery.
Yeah.
Let's make
Yeah.
sure we get that set up.
Yeah.
Or if they come in after, they're still having pain, okay, let's try PT.
Yeah.
But if they come in and they're doing great, we don't want to rock the boat. So
Right. Yeah.
let's
Right.
leave
Right.
PT
Let it
alone
be.
for right now.
Yeah, let it
You
be.
know?
Okay.
Do you? Let me follow up on
Sure.
that,
Yeah,
and then
yeah,
we'll let you talk.
absolutely.
So for PT services,
Yeah.
does that have to be authorized as well? Does there
No.
have to be? So that's just he says it's needed.
Writes the referral.
and it's done.
We ask the patient,
Okay.
where do you want to go? What's
All right.
convenient for you? And
Okay.
we get that set up
Perfect,
for them.
Perfect.
Yeah.
Excellent.
No, I was just going to say, Nikki's absolutely right. Some of our more elderly patients, especially when we do send them home the same day after surgery, in those situations, we can set up certainly home health care in advance, and we do that sometimes, or set it up afterwards. But usually those are the folks that need something set up at home.
All right. So post-surgical, you're seeing the patient come back in. I want to go back to some of the billing stuff. Okay.
Sure.
Because that's what I get the majority of my complaints
Of
about,
course.
as a hospital administrator.
Yes.
But do you find it difficult to get pre-auths done for this type of service?
So actually, we just brought Shay on board. Shay used to work in the OB clinic upstairs,
Yeah.
and she's now been doing all of our authorizations, and she's been doing great.
Oh,
I
nice.
mean,
So, okay, that's awesome.
so we have
Yeah.
her kind of looking at the cases on a week-to-week basis, making sure that we have all of our authorizations in place. If the surgery was denied for any reason, getting on the phone, getting those peer-to-peer set up
Yeah.
so that way he can,
Yeah.
grab the phone and try to work something out with the insurance company
Yeah.
prior to. But we're getting these authorizations.
Yeah.
We're
Excellent.
Good.
we're not having any
Excellent.
issues.
Good,
you
good.
know.
Because that often is a challenge in our
Mhm.
industry. Is patient has to wait weeks and weeks.
Yeah.
Right.
You're familiar with that
Yeah,
with your,
yeah,
your
with
husband.
my, yep.
And or you're fighting the insurance company
Yeah.
because they won't allow it. But you find that that's not an issue.
I mean, we're definitely
good.
we're having the fights,
Sure,
and,
sure.
and
But they're
There's always some
controlled.
fighting.
there's always
but
some
They're
fights,
always
but
there.
we're,
It's-
yes,
it's
controlled.
insurance companies.
Right.
It is.
Yes. Mhm.
And I'm sorry. Did you want to say something?
Oh, all I was going to say is that, and prior to Shay starting with us, we did these all ourselves,
Yeah.
and nobody really taught us to do them,
Yeah.
and being, before we started our own practice, we worked for different hospital systems, and there was always somebody to do that. We learned to do it on our own, and as a result, I think we have a really good understanding of how the process works,
Right.
perhaps better than we would otherwise.
Right.
And so I think that helps us in getting
Right.
things
It
approved,
does.
and we
Because you've
certainly,
seen how the process works
Yeah,
start to finish.
definitely.
Not
Yeah.
you've been exposed to just one piece of it because you're part of a bigger.
and then we pass that on to
Yeah,
to
we would
Shay
be
as
in
well.
clinic all day and then go home at night, take the
Spend
laptops out,
hours
and just
just
go to work.
Go at it.
Yeah.
Yeah, absolutely.
All right. So here's a
Right.
$1 million question from both of your perspective. Let me start with you first.
Yeah.
How's it been at Hillsdale? How's the reception
Oh
been?
my gosh, you guys! The best part, honestly, has been the community. Like the community, I cannot stress.
Yeah.
I mean, these people come in with baked goods,
Yeah.
fruits from their gardens,
Isn't it
like
amazing?
Hillsdale College T-shirts for my kids.
Yeah.
Like
It's cool.
the
love that.
community is so giving and
Yeah.
so warm, and so
Right.
they've been so receptive to us. And
Are you familiar with small communities, or did you grow up in a big city?
no,
or-
I was downriver actually.
Oh, downriver,
so
so,
Allen
all right,
Park for
Allen
20
Park area,
years,
yeah.
and
Yeah. So seeing this type of community is a little different.
it is
you know,
wild.
they all
I
come
mean,
together.
everybody's just so darn nice,
Yeah.
and this has by far been the best part of the
That's
job
awesome.
for me.
That's awesome. That's
Mhm.
great. All right, from your perspective, how's your reception been? Talk about it from, she kind of gave us a patient perspective, but medical staff and other folks and, colleagues and that type of thing.
I think the huge benefit of having to being somewhere like Hillsdale and being a small community is that people are excited for me to be here. People
Yeah.
are nice to me.
Yeah.
It was very welcoming, and what that does in turn, I think it allows us to be ourselves and
Right.
then
Yeah.
and really provide our best care because
Right.
we're comfortable.
Right.
Yeah.
Absolutely.
You have
Absolutely.
probably those better relationships with your patients when
Yeah.
Yeah.
they're
I
very
mean,
receptive like
the
that.
people are coming to us at their most vulnerable state,
Yeah.
right?
Yeah.
They're in pain.
Yeah.
They've been living with this for years.
Yeah.
They're suffering. They're emotional. I
Right.
always tell patients if they lash out or something, I always say, I get it. Pain is so emotional.
Yeah.
Yeah. it
And
is.
and so they know that they can be vulnerable with us, they can share with us. We really want our patients to feel like we're not just providers, like we're here to like take care of you, make
Yeah.
sure that it's
Yes.
all okay, make sure that the big picture is okay, and you're not just here for your back, like
Right.
It's a holistic
It's
approach
yeah.
to the patient.
But we just want them to feel like it's more personalized care.
Yeah.
The biggest complaint we hear is like, when I go to other doctors' offices, it's just so sterile and it's
Yeah.
just like, get me in, get me
Right,
out.
right.
And I don't want my patients to
Right,
feel like that.
right.
I want them to feel comfortable enough
Yeah.
to talk to us, let us know what's going on.
Yeah.
Are you still in pain?
Sure,
What
sure.
more can we do for you?
Sure.
How can we fix this?
Right.
We could probably get home a lot sooner than 7, or leave the office a lot sooner than 7,
Seven
but
or
we
eight.
chat a lot with
We
people.
talk,
Yeah.
and
It's
that's what they
important.
love because
It's
they're
important.
like, man, he spent so much time with me.
Yeah.
And he does. He will. I hear him in there talking to people about their grandkids,
Oh, yeah.
about
Yeah.
where they're going on vacation, and it's not
It's
just
that personal touch.
yes,
Right.
It is.
yes.
Right.
So once you've engaged with the surgical procedure and post-discharge, if they are inpatient, if not, if they go the same day, what's the because we have physicians that listen to this, what's the communication with physicians, primary care, or is that left to the patient to communicate that?
That's a good question. That's actually an area that we need to expand a little bit more.
Okay.
And part of that's we've been here 7 months now.
Yeah.
If I have an issue or if
Yeah.
a patient has an issue,
Right.
I will try to call.
Okay.
And
Good. Good.
some providers, I have their numbers,
Yeah.
and I'm trying to hand out mine to others.
Right.
Certainly, I invite anybody to call me or
Yes.
text me
Yes.
if they have any issues. But medical record systems are different, and we are. That is something where we do rely on patients to pass on good news.
Yeah.
And if there's an issue or something that we need to communicate with somebody with, we try
You'll
to reach out
to them. Great.
But that's certainly something we could improve.
Yeah. Well, always opportunities. Anything, Rachel?
So I think we went over all the last questions aside from how do patients get in contact with you? What number do they call?
So the 517-314-2990 is the best way to get a hold of us. That is our cell phone. It's, we have it on us at all times.
Yeah.
That's the easiest way to get a hold of us. And if you call and you leave a voicemail, if I can't, I'm the only one who answers the phone. You're going to talk to me every time. Just leave a voicemail and I will call you back, get back to you and get you scheduled. And, but that's probably the best way to get a hold of us.
So, from your perspective, give me the top 3 things why I would call your office in terms of what pain am I experiencing? Is it numbness of the arm? Is it hand? Tell me what are the 3 things that if they're out there listening today and like, oh my God, I should go see him because I have X.
Yeah. So I think numbness or tingling in the arms or legs, number 1. Severe back or neck pain that's getting worse no matter what you do. That's 2. And I'd say 3 is something like sometimes people don't think about. If your foot stops working, if you have a foot, what we call a foot drop, those are all concerning things, and we want to hear about those.
And early detections, early
Absolutely.
prevention. Obviously,
Absolutely.
your goal is to get them in just as soon as they start experiencing this. Don't wait.
Yeah.
You don't need to wait. You can come to Hillsdale right here in your backyard.
Exactly.
Right here in your backyard.
Yes.
There's capacity to get you in. Nikki's already said that she loves people and she'll even just squeeze you in at, maybe even 10 o'clock at night. Who knows? Maybe there's be a third shift office. I don't know.
Our nanny loves getting the extra hours.
Exactly. Yes. That helps the nanny. But I want to thank both of you, truly. This has been very, very important for our continuum of care at Hillsdale. It's necessary. It's needed.
Yeah.
Our physicians needed it. To have you here practicing is important. Not just using the OR for services, but practicing, in the 3 Meadows, but then engaging in your surgical services at our hospital. Anybody can come set up shop. But for someone to invest at our hospital and invest in the community, that is the win that we needed. And I want to thank you both for making that, because I want our listeners to know this is hard to start your own business, to pay for your staff, to wait 4, 6, 8 months for the insurance companies to start paying you, to have all the overhead, the cost associated. It is a huge. This is why primary care providers and specialty providers like neurosurgery do not do this on their own, because it is a huge investment out of their pocket. So I want to ask you, I'm pleading with you, you have someone in our backyard right here, world-class service in neurosurgery. Use him. Use us at Hillsdale Hospital. You do not need to travel. You have access right here. And by promoting this service, which you are, by utilizing it, you tell your friends and family who may be suffering and who may have ailments as well, and encourage them as well to use those services. And that ties back into our growth strategy here at Hillsdale Hospital, expanding our OR services so that we can sustain this hospital for another 100 years. And the way that happens is because we invite your trust to use us. Nothing grinds me more than to hear someone say, well, we go to the University of X, or we have to go to the big system. Really? You just heard
we couldn't do it here.
Couldn't?
Didn't.
You didn't want to, because you just heard from this guy who's been, he's been everywhere, man. And he's told you that we have the tools, the skill set, the people that can make this happen right here in our backyard. Why not use us? And so it benefits and props up the hospital financially and allows us to continue to serve this community. So I would encourage you, if you have any of these pains, ailments, reach out. Nikki's going to receive you on that phone call one way or the other. Either she'll let it go to voicemail because she's answering 10 other calls, or she'll answer your call and you will get a call back. And come to Dr. Loganathan, have that discussion. Not everything's going to end in surgery.
Nope.
No. People are afraid of surgery.
No.
Not everything ends in surgery.
That's probably one of the main reasons people put off actually seeing
They
anybody
do.
Yeah.
is because they're afraid they're going to be told you have to have surgery.
That's
We
right.
have 0 scalpels in the office.
Yeah, exactly.
Perfect.
Yeah.
So
See?
nothing's going to
It's
happen
okay.
there.
Just
Nothing's
call.
going to
Just
happen
get
there.
information.
And just to piggyback off what you were saying about the hospital, I'll have to tell you the patient feedback with their experience at Hillsdale has
Yeah.
been phenomenal.
Yeah,
you know?
one of your patients from a different area. They're not from Hillsdale, which is really unique because when we look at specialty care like Dr. Loganathan and others, urology, they're bringing patients to us from other areas outside of Hillsdale who've never experienced the Hillsdale Hospital way.
Yeah.
And I'm getting comment cards like, "You have a gem." Of a hospital, like, "Oh my God, you people are so
And
friendly."
we're hearing it.
And it's like we're engaging, and that, I think, if there's anything we can tell the broader audience that listen to this live, is that we are unique. It is different here.
Yep.
I go to a lot of hospitals. You do as well. We speak across the country. We see hospitals. We are unique. This is pretty exciting what's happening here. So you get that personal experience. Most of the surgeries, as Dr. Loganathan has said, is outpatient. So you're out the same day. Your loved one can not only wait here, but also go enjoy the downtown because there's economic development that is happening in Hillsdale. Great opportunities to engage in our community. And then you go back home and you come back for your appointments. It's a trifecta.
Yep.
And so we would encourage you, reach out. There'll be a number on the screen, or was a number on the screen, knowing Kirsten, and as well as contact information that will be provided. So before Rachel closes today, I'm going to have her do that. Kirsten, any questions from the audience? Wow, we've
All right.
successfully answered them all. Excellent.
Great.
It's been great having you both here
Thank
today.
you.
Thank
This
you
is so
so
exciting.
much.
and
Thank you so much.
Thank
I'm going to
you,
have
guys.
Rachel take it away.
Yes, because we got to get you back over in the
We do.
OR. Timely
We do.
here. So to close, as always, we want to thank you, our community, for all of your continued support. We do now have one single URL for all of the different things we talk about in our closing for you, which is hillsdalehospital.com/live. If you go to that link, you can nominate a hospital staff member for our quarterly patient care award based on the experience you or your family member had. You can support our capital fundraising campaign there. You can learn about volunteering opportunities, and you can even join an award-winning workplace in the healthcare industry by checking out our career opportunities and current openings right there on hillsdalehospital.com/live. So everything is in one place for you. Catch us on WCSR on Fridays and Buzz Online on Saturdays with our 10-minute segment that we do. And don't forget to check out our national podcast, Rural Health Rising, at ruralhealthrising.com, or you can subscribe wherever you get your podcast. Whatever your favorite podcast app is, you can find us in there. So we will see you here again next time. And until then, stay safe, stay healthy, stay Hillsdale strong, and choose Hillsdale first.